Topic for this session is supports of uterus. First question is, why do we need to study about this topic? So the reason is because during normal delivery in a female who has given birth to many children, or during old age also, in some females the uterus comes out of vagina, which is called prolapse of uterus. So we need to know what are the factors which are preventing this prolapse of uterus. So first we start with what is the normal anatomical position of uterus. The normal anatomical position of uterus is anteverted and anti-flexed. So that means the uterus is bent forward over the vagina, which is called anteversion, and uterine body is bent forward over cervix, which is called anteflexion. Now next question which arises is, why prolapse occurs? So this prolapse occurs when this anteverted and anti-flexed position of the uterus is disturbed. So how it is disturbed? So let us see what normally happens. This is the uterus with the cervix. This is vagina, rectum, anal canal, and in front there is urinary bladder. This is the pubic bone symphysis pubis. Here is the sacrum. This is perineal body. Now you see, normally the uterus is angulated forward. You are looking at the pelvic viscera from the lateral side. So uterus is resting over the upper surface of the urinary bladder. But when the urinary bladder is distended, the uterus becomes straight. So it comes in line with the vagina. So there are chances, if other factors are not favorable, that the uterus may come down through the vagina. With further distension of the urinary bladder, uterus may be reversed angulated. So this backward angulation of the uterus over vagina will be called retroflexion. So in this is called a retroversion and retroflexion. So in this condition you see the normal position of the uterus is completely reversed. Now it may happen that due to some local disease, the uterus is fixed in this retroverted, retroflexed position, or this condition may be present congenitally by birth. So in those cases, there are chances that the uterus may come out of the vagina if there is weakness of the muscles of the pelvis and the ligament tone is not strong enough. Now sometimes it may happen that not only the uterus comes out, a part of the urinary bladder or part of the rectum anal canal may also come out of it, which are respectively called vesicocele and the rectocele. So we need to learn about the supports of uterus. So let us see what are the factors which support the uterus. There are two types of factors. There are structural anatomical factors which are supporting the uterus in its position, and these factors have some functional components. So what are the structural factors which are keeping the uterus in position? There are a few ligaments which are important. the muscles of the pelvic floor, and there are some viscera. All these are helping to maintain the anteverted and anti-flexed position of the uterus. The functional factors are these things. Out of these structural factors, some act from above and act as sling. Some factors act from below and sustain the uterus from below. Some factors act from sides. The most important is they are all maintaining the anteverted and anti-flexed position of the uterus. And finally, we cannot ignore the importance of the packing material, that means the parametric tissue, which is present within this area, which is keeping all the viscera in their position. So let us first discuss how the ligaments help. Again, this is the uterus with the cervix. This is anterior wall of vagina. This is the posterior wall of vagina. Rectum, anal canal, sacrum, the urinary bladder, symphysis pubis, and perineal body between the vagina and the anal canal. Now, the ligaments, we are talking about the true ligaments of the uterus. So, what do you mean by true ligaments? True ligaments are generally formed by thickening of the local parametric tissue, which I told you form the packing material. So, the local parametric tissue thickens to form ligaments, but one of them is a developmental ligament and is called the round ligament of uterus. This round ligament of uterus starts from the angles of the uterus and is attached to the labia majors. So there are two on two sides. They are pulling the uterus forward. Right? Now there is another ligament which is actually pulling the cervix behind and is called uterosacral ligament. So this one is a round ligament. This one is uterosacral ligament. This excessive pull of the uterosacral is further prevented by another ligament which is called pubocervical ligament. This pubocervical ligament is attached to the pubis and it prevents the excessive pull by the uterosacral ligament. So these three ligaments are very important in maintaining the anteverted and antiflexed position of the uterus. Now there is important fourth ligament which acts from sides. So now we are looking at the uterus from front. The body of the uterus. Here is the cervix and this is vagina. These are the two pelvic walls. So you see the cervix is kept in its position by horizontally placed ligament and is called McEnroe's ligament. So these four paired ligaments are very important to keep the uterus in its normal anatomical position. Now the second factors which we were talking about are the muscles. Which muscles? They are the muscles of the pelvic floor. They are the there is this very important perineal body, and then there are muscles of the anterior abdominal wall. So again, if we look at this picture where the uterus is placed in anteverted and anteflexed position, this is again the rectum, anal canal, and this is urinary bladder. So you see the pelvic floor muscles of these, the most important one is the levator ani muscle. This levator ani muscle, it forms the pelvic diaphragm. So it actually keeps all the pelvic organs in its position by its muscular tone. Now this levator ani muscle itself has different components, different slips, of which two slips are very important in keeping the uterus in its position. So those are, I'll write with green. There is one pubo-vaginalis muscle. This pubo-vaginalis muscle, it pulls the vagina forward, and the main function of this pubo-vaginalis muscle is to decrease the urogenital outlet. That means it narrows the wall of the vagina, it narrows the wall of the urethra. When the wall of the vagina is narrow, the chances of uterus coming down through it decreases. Next is puborectal sling. So this muscle actually encircles the junction of the rectum and the anal canal. So what is it doing? It is basically, this is puborectal sling. So what is it doing? It is basically maintaining the anorectal flexure. Now this anorectal flexure makes the rectum and anal canal like a chair over which the posterior vaginal wall is resting. And as I have told you, on the posterior vaginal wall, the tip of the cervix rests. Hence, this puborectal sling is actually helping in maintaining the anteverted anteflex position of the uterus. Now, let us talk about this perineal body. This perineal body is a pyramidal shaped fibromuscular organ. Now this one gives attachment to all the muscles of this area. The muscles of the pelvic diaphragm, the muscles of the perineum which lies below the pelvic diaphragm, the muscles of the different viscera which are present here like the anal canal, vagina, urethra, they all get converged on this perineal body. So for maintaining the strength of the muscles of this area, this perineal body is very important. This perineal body may get damaged during the normal labor, or it may get injured due to some external injury also. If so, then even if we repair it, the chances are that the muscles of this area, they become weak, and when they are weak, then there are chances that uterus may come out through the vaginal opening. The third is how the anterior abdominal wall muscles are helping to keep the uterus in its position. The tone of the anterior abdominal wall muscles actually pushes the coils of small intestine and the sigmoid colon into the pelvic cavity, which in turn pushes the posterior wall of the uterus so that the uterus rests on the upper surface of urinary bladder. Hence, the tone of anterior abdominal wall muscles is also important. Now, the third factor which we were talking about was the viscera. So, what are the viscera which are helping to keep the uterus in position? the upper surface of urinary bladder. One thing, the posterior wall of the vagina and the chair-like anorectal flexure of the rectum and anal canal. Fourth are the coils of small intestine and the sigmoid colon, which are pushing the uterus over the upper surface of urinary bladder. Now, how they are acting is the functional components. The peritoneal folds, which are actually the false ligaments of the uterus, like the suspensory ligament of the ovaries, the uterovesical ligament, or the recto-uterine fold. These are the folds of the peritoneum which actually from above support the uterus to go down. The muscles of the pelvic floor, the pelvic diaphragm, and posterior wall of vagina and urinary bladder, which are supporting the cervix and the uterus respectively, they act from below, so they provide a sustainable action from below. From sides, the McEnroe's ligaments are keeping the cervix in position and hence the uterus. And these three ligaments are actually the most important factors which are maintaining the anteverted and antiflexed position of the uterus. The packing material, as I have already told you, is formed by the condensation of the local connective tissue. So this was all about the supports of uterus.